a unique and provocative look at today's current events. We provide the answers and a better understanding of the world around you. So catch Therapy Cable Live, Monday through Friday from 12 to 2 Pacific Time on therapycable.com. Well, this is one of the subjects I really wanted to discuss. It's a very interesting subject. Like I was saying earlier, we really have to help as much as we can our military. They provide us the freedom, the security, and the peace that we get to enjoy each and every day. And a lot of these people are going over to the other countries and fighting wars and in situations that are just horrible. And I have to commend them for that, and I respect them, and we also have to take care of them. So with me today is Dr. Valerie Hardcastle from the University of Cincinnati. She's a professor of philosophy, psychology, psychiatry, and behavioral neuroscience. We don't even have enough time to talk about everything. So we're going to welcome her to the show. She's going to talk about traumatic brain injuries in the court systems. Welcome, Dr. Hardcastle.
Thank you very much. I'm very happy to be here.
Thank you for being here. Now, before we get into the legal aspects of it, I wanted to see if we can tell the audience a little bit about traumatic brain injuries.
Sure. Well, most people are probably familiar with traumatic brain injuries from discussions of football players, although they generally have a different type of brain injury that you see with our returning American vets. In many ways, the outcome is very similar, in that if you rattle your brain around in your skull, it causes damage to the brain. And in particular, if you notice your eyeballs, right behind your eyeballs, there's some bony protrusions inside your skull. And so if you get knocked on the head, what happens is your brain runs into your skull and bangs into the bony protrusions and then bangs against the back of the skull and back and forth. And as a result, your brain gets bruised, it swells, and then neurons die. And unfortunately, with a lot of traumatic brain injury, particularly the type you see with explosive concussive injuries like we see over in the Middle East with a lot of our soldiers, it affects their frontal lobes, which is the part of the brain that deals with planning, with rationality, decision-making, emotional control, and these sorts of things. So as a result, a lot of our returning vets, in addition to other sorts of physical injuries they might have to deal with, also have to cope with some cognitive and functional deficits.
Now, let me ask you a couple of questions before we get into those. I'm not really aware of this, but you said some of the neurons would die. Can they regrow?
No. There are some neurons that can regrow in the hippocampus, which deals with your memory areas, but unfortunately, for most of our brain areas, we cannot regenerate neurons. Sometimes we can grow new connections, and it's a very hot field of study in trying to understand under what circumstances can we grow new connections and under what circumstances can we not. And it is the case that a lot of people, particularly if you have mild traumatic brain injury, that you can regain normal functionality. But not surprisingly, the worse the injury, the slower and less the recovery.
And most of these injuries, are they coming from IEDs, I'm assuming?
Yes, they are. For our military personnel, yes. Most of them are some sort of explosive concussive type injury.
Oh, terrible. And what are some of the things you were saying earlier that impacts their cognitive functioning? How does it impact it? Do they have a harder time learning things? What's going on there?
They have a harder time learning things. They have a harder time paying attention to things over time. They have a challenge in multitasking. You know, most of us multitask all the time because we're texting, we're talking to friends, we're doing Facebook, and we're trying to work. And they have a hard time doing that. But where it also shows itself in particular is with issues of emotional liability, which means that they are much faster to get angry and they can't control their emotions in the way that most of us can. And so that's really where they start getting in trouble because they're not really able to control their behavior if they happen to get upset in the way that society expects people, adults, to be able to do.
I want to warn the audience here, we're going to get into a little heavy talk for a second here, but so is that affecting the prefrontal cortex, it sounds like, being able to lack the emotional regulation then?
Yes.
Okay.
That's right. And so that's a major place where you find deficits with traumatic brain injury, although depending on how your brain gets rattled, you really can find deficits everywhere. But it's the challenge for our vets with cognition and affect or emotion that I think is driving a lot of the research and driving a lot of the concern, particularly with how vets end up intersecting with our criminal justice system.
Well, you made a beautiful segue, so let's talk about that. So what's going on here in regards to the TBI and the criminal justice system?
Well, the challenge is that, and here I'm just going to speak in gross generalizations, so people need to understand that I'm not saying that all of our vets are like this, or not even most of our vets, but there is a significant component who come back and they experience depression, they have a hard time adjusting to civilian life, and they engage in substance abuse of one type or another. Quite often that will start when they're overseas as a coping mechanism, and then it continues over here. And then as a result, something happens. They get into a bar fight. They hit their spouse. They knock around their kids. They engage in road rage. So all these sorts of things can happen, in addition to, for our vets who come back with addiction and substance abuse problems, just having that problem on top of it quite often creates an intersection with the criminal justice system. But
now, to stop you for a second, so that's independent of the TBI?
Well, that's caused in many respects by the TBI.
Okay.
Yeah. And so then the challenge, I think, for our criminal justice system is it's set up assuming that everyone is rational and in complete control of their behavior. But the reality is a lot of people aren't always able to control their behavior in the way we think they should. And I think America right now really has a soft spot for our veterans, and people don't like the idea that somebody went overseas and sacrificed in quite often horrific ways, and then they come back, and as something that we can trace directly to what they were doing in sacrificing themselves for this country, they're ending up being arrested and perhaps going to jail or something like that. And so one of the challenges that we're seeing in our criminal justice system is how to deal with these veterans who are coming back with fairly extensive brain damage and then engaging in behaviors that are consistent with that damage, and how to think about that. So it's changing, I think, some of our criminal justice system practices.
Absolutely. I can only imagine so. Absolutely. Now, let me try and see how I can figure out any cases that stand out that you thought, when you saw it, you said this is a clear sign of TBI, but they're interpreting it as just an everyday crime. In other words, maybe an assault had taken place, but they're treating them as an individual who doesn't have TBI. Do you see that a lot?
Well, honestly, that depends on where you are in the country. So I'm in Cincinnati, and in Cincinnati, we have now what's known as a diversion court for American vets. And so if you're a vet and are arrested for a crime that's not too severe, then you could get diverted into a rehabilitation program as opposed to going through the normal court system. There are about 80 such diversion courts in the United States right now. So if you happen to live in a jurisdiction that has them, that's one strategy for dealing with this segment of society. In other places, the American court system really is just not set up to deal with people with this type of brain injury who commit crimes. And so by and large, they will be treated as regular criminals and be sentenced as such. Now, the hopeful news is that maybe they'll be able to get some therapy for their brain injuries while in prison if they are not able to get treatment outside of prison. But that seems like a rotten way to get medical assistance for brain problems.
I'm going to call you an expert of segues. That brings me to the next question. What is the treatment for these individuals? Can they be helped?
Well, again, it depends on what the injury is and how severe it is. I would have to say, though, by and large, no, we don't have great treatments for traumatic brain injury. You can do some therapies that will help, help them focus their attention. There's some medications that can help you focus your attention. There are some medications that you can take that will sort of damp down your tendency to anger. You can also engage in some cognitive behavioral type therapies that will make you more aware of what's going on and give you better coping skills. But the reality is, for a lot of our vets who are coming back with severe brain injuries, they're never going to return to their baseline normal. And
Wow.
so we're going to have to figure out a way to manage this segment of our population.
Absolutely. That's terrible. So it doesn't work like a muscle then. I know we were talking earlier with Professor Levon about memory, and he was telling us, to make your memory better, you kind of work it like a muscle, you use it more, chest and stuff like that. But in this case, they can't really develop any more in that prefrontal cortex area or any other area.
That's right. That's right. So they can substitute sometimes different areas for the brain to compensate for what they've lost. But of course, the substitution is never quite as good as the areas that they've lost. So I would say for a lot of people, particularly if they can get therapy, they can get better. But for, I would say, a substantial population, they're never going to be 100%. And that's just the sad reality.
That's a terrible reality, yes. And are these individuals aware of this lack of control or inability to focus?
I suspect that they are, although, one of the things that studies have shown, particularly the RAND Corporation has done a lot of studies in this area, is that about half of our returning vets who do suffer from traumatic brain injury do not seek therapy for it.
Wow.
And part of that has to do with the attitudes that are prevalent in the military, which is basically you suck it up and take it. And so asking for help and assistance is actually very hard for a lot of our vets. And so a lot of times, even though they're aware that they're not thinking in the same way they used to think, or they're depressed, or they're anxious, or whatever it is, the reaction is, I need to manage this on my own, as opposed to, I need to reach out and get help. And that, I think, is another issue that we have with a lot of our veterans, is simply the culture of the military, which prizes independence and self-sufficiency, actually works against the vets after they leave the military, because then they're less inclined to get the help that's actually available to them.
Oh, yeah, that's terrible. We've got a couple minutes left. Any insight in regards to gender differences or age differences? Does it affect these populations any differently?
No, as far as I know, there's no real differences in gender, other than, of course, we had many more men serving overseas than we do women, but the effects on the brain are essentially the same. It is the case that the older you get, the worse the prognosis is. And part of that just has to do with our brains naturally degenerate over time. And so, if you're 70 and you have a traumatic brain injury, it's much more difficult for you to recover than if you have the same injury when you're 7 or 8.
So, and right now, you're a part of a group trying to help these individuals out as well, right?
Well, yes. So I'm part of a program in the law school, which is the Weaver Institute for Law and Psychiatry, that's looking at this problem. But really, I have to say right now, we are in the data collection portion. I don't know that we can offer anything but educated guesses about the best thing, because the diversion courts that we have for our vets are new. They've only been out for a few years. So we're still collecting data on how successful they are in being able to help the veterans reintegrate into society and not reoffend. But all the data right now look very promising that this is, in fact, a much better and more cost-effective way to manage some of the offenders that we have, because they are able to get treatment, they are able to get better, and then they are able to reintegrate into society, as opposed to what happens with some criminals, as you know. When they're released from prison, they end up reoffending because they just don't have the support system or a way to reintegrate into society successfully.
Well, there's good news.
Yeah.
I was looking for that nugget. There it is. And at last, we got about 1 minute left, maybe a little less than that. Any kind of preventative techniques that you're aware of, specialized helmets that they're working on, or anything to minimize the damage?
For military personnel or just in general?
Military personnel for this case, yeah.
No, well, I'm sure the military is working on that. However, they have not told me about what they're working on. And part of this is the wars that we fought most recently are really the first one where we've had these sorts of IED-type explosive devices. And so the military is, in many respects, playing catch-up to figuring out how to deal with those types of weapons. And I'm sure they will come up with some better armor, better body armor, and better types of helmets that will help prevent these injuries in the future.
I hope so. Dr. Valerie Hardcastle, thank you so much for being here.
It's been my pleasure.
Where can we get more information about you and your group?
Well, let's see. Now you caught me off guard because I don't have that information handy. But if you go to the University of Cincinnati website, which is uc.edu, and then just search for my name, I will pop up. And that's probably the easiest way to find out more about me and what's going on.
Actually, you have a lot of articles and I think commentaries as well if we Google Valerie Hardcastle, if I'm correct.
I'm sure, yes.
Yeah, you have some fascinating ones. That's how I learned about her. Wonderful. Thank you so much, Dr. Hardcastle. Thank you for all the work you're doing out there. We truly appreciate it.
You are most welcome. Thanks for having me on your show.
Well, there you go, everybody. We need to help our military. We have to help this organization out, the groups out there who are trying to help the military, whether it's University of Cincinnati's program there or others. They're trying to help minimize the brain damage that's going on and any other sufferings that they may have out there in the military.